Hi, welcome to the Kiwi Ads and Mods tutorial on metatarsal arch supports. Today we'll be looking at three different mods: the Met Pad, the Met Bar, and the Neuroma Pad. To start with the Met Pad, this is a very common addition to an orthotic device that can effectively offload pressures across the forefoot by increasing plantar pressure right in the center of the metatarsal arch underneath the shafts of the second, third, and fourth metatarsals. And it works directly to offload pressure from those same met heads and indirectly offload pressure from the first and the fifth. The shape is that of a slanted dome, or if you know the shape of an airfoil, it's very similar to that, where there's a very shallow slope leading to a sharper drop off right at the end. And it's to provide a comfortable amount of pressure leading up and then directly reaching peak pressure right in the distal part of the metatarsal shaft before the metatarsal head. We do this by placing it 3 millimeters just distal to the metatarsal line or the 3/4 mark of a shell. And it's typically the most comfortable placement for the pad as it avoids direct pressure right on the metatarsal heads while still supporting the metatarsal or transverse arch. But for patients who do have significantly depressed transverse arches, so if that forefoot is really uh, bent the opposite direction, really convex instead of concave, you can have these placed distally, of course. Just let us know by how much you want that distally placed so that it's directly underneath the metatarsal heads and really pushing up to support those areas. Now, keep in mind, do that with caution because it is typically uncomfortable for a lot of feet to have that increased pressure, especially if those areas are already sensitive. Um, the standard heights on the order form that you'll see are low, medium, and high, and that correlates to 2, 4, or 6 millimeters. As you can see, the one I've got here, this tool is set at 4 millimeters, and that's right at that medium height. They also come in two different sizes. And the tech who's grinding this will choose the size of the pad depending on the width of the actual shell. So for larger feet, of course, we'll use a number 6. For smaller feet, a number 3. And you can, if you have a preference, specify which size you'd like on the order, as well as the height, of course. Um, Going to metatarsal bars, they're very similar in overall shape and position, with the main distinguishing factor being the width of it. The bars are designed to provide a broader support to extend under the shafts of the first and the fifth to help directly offload pressure from those two met heads. And if you'd prefer, you can see the sample I've got here. There's still a little bit of shell on each side of that metatarsal bar, which is pretty standard. So we can, just for comfort and to help adhere the top cover properly. If you prefer that to go right to the edges, do let us know in the notes. And they can be a little bit less comfortable from the metatarsal pad because we're getting a little bit away from the anatomical shape of the foot when we add this sort of modification. But as I said, it can provide more offloading pressure if there's a lot of sensitivity to those particular metatarsal heads, things like sesamoiditis or plantar warts or whatever the case may be. Neuroma pads are the least common by far of the three, and they should be approached with a heavy amount of caution as they can be uncomfortable for many patients. And it's often worthwhile to try one of either the Met pad or the Met bar for effectiveness and relief before moving to an neuroma pad. In terms of the physical dimensions of it, as you can see, they're essentially just a small little wedge-shaped device. You can see it's sort of got a wedge shape. This is a 3 millimeter high, about a 5 to 8 millimeter wide breadth, and we need to know exactly where you want this placed on the shell if we are going to be placing it and finishing the orthotic for you. There are four options. For 5 metatarsal bones, we have 4 interspaces between those bones. So you need to let us know if you want it in the first, second, third, or fourth interspace. Um, it can be a little bit of a confusing topic, but hopefully that made sense, because the job of the neuroma pad is to effectively act as a wedge to help lift and separate those bones to help prevent impingement or pressure increasing on either the nerve or other soft tissues in those areas. If you are a clinician that has your own lab space in the clinic, for adjustments or finishing work, I often recommend just ordering these loose and having the covers come separated so that you can place this and cover it at the fitting at the pickup appointment, and you can be assured of its most comfortable and accurate placement there. Um, if we are finishing the orthotic and placing these for you, be sure that you are exact in where you want this placed. And the more information that we get, the better success we're going to have. But there is a very high, I would say, a negative compliance rate with neuroma pads. So approach that one with caution. And as always, if you have any questions about these, please reach out. You can get us directly at tech@koslab.ca. Thank you.